Hi there, and thank you for joining us for more. As you know, each week I always state that we as a show exist for you. And yet I have been left with a real nagging disappointment more than once because I know that I've wimped out in an interview or two, because I didn't demand more than polite talk or rhetoric from the guests. And that's not fair to the guest, to you, and especially is not in integrity to what this show is about. In the spirit of the journey, it is highlighted to me in a real way how easy it is to just go through the motions. It also highlights to me that something exists at a very accessible level that makes shortcuts way too justifiable and easy. I do understand why this happens and why we excuse ourselves for it, because most of us, we just choose short-term gain without realizing that by doing so, we're also choosing longer-term pain. We do it consciously, by not thinking through the consequences of our own actions. So are we here to be more aware of what could be, or are we just going to accept things as they are, what is? Can our own increased awareness be that powerful and critical to the whole process? More is a choice, and it's just like increased awareness that way. We get to choose where we focus our thoughts and minds, and it does require vigilance. Often I hear people say that they must be vigilant so that they can avoid X or Y. The vigilance, though, that I'm talking about is for truth, not for substitutes. More is a personal journey about self, and to learn more about ourselves, the first part of the journey must be a solitary one. This is where we answer some of these questions in a real honest way. Things like, are you happy? What makes you happy? What are 5 things that make no sense to you or have no real must-have value in your life, but yet you keep accepting? Just start with these questions, answer them, and we'll keep building on them each week. And joining us today on our show is Dr. Kellie Leitch. She's one of only a few cross-appointed professors in a faculty of medicine and a faculty of business at a Canadian university. Kellie is the youngest division chair of a surgical specialty in the history of the university and hospital, and the youngest division of pediatric surgery chair at an academic health sciences center in Canada. She also chairs the new health sector MBA program at the Ivey School of Business, and with the objective to produce doctors who, like her, have business acumen, medical expertise, and political understanding. Kellie, thanks so much for joining us today.
Thanks for having me.
You know, what I'm really impressed with, Kellie, I want to start with, is just how you've honored 2 of your passions so successfully in life. Business as well as the medical side of things.
I've been extremely fortunate. I've been given great opportunities at the University of Western Ontario, and I'm well supported by both my deans, Dean Stevenson and Dean Herbert, so it's been a fabulous experience.
Great. Well, obviously you have a lot to do with that. You know, one of the questions I wanted to ask you is, just as a person, what were you most aware of in your life, just personally?
You mean from a value that I hold, or are you
Well, just even kind of when you were growing up as a young girl, what were the things that you found yourself most noticing?
I think that the thing I noticed the most about myself was that I was, driven to accomplish tasks. That, and I was interested in many different things. And so both of those have contributed to where I find myself today. Being motivated to get things done and having a good work ethic, something I learned at home, but also being given great opportunity to do a whole bunch of different things and sample them, and in some cases be more successful than others. But it's, I guess those would be the 2 things. One, thinking that I really like to work hard and be focused, and then the other is to achieve and accomplish goals.
Wow, that's actually exciting, because those are 2 truths that can apply themselves to so many different areas of life. And so I guess that's, again, really shows up in your ability to successfully honor the 2 different sides of you. You know, I'm curious of how this awareness actually influenced you, because you had awareness of what jazzed you. How did you let that influence you for your subsequent decisions and choices?
Well, I think part of it is me being aware of it, but also, quite frankly, my parents and the mentors that I have being aware of it as well, and stimulating my curiosity to do different things. So whether it be on the business side, my father's an entrepreneur, but I've also come in contact with some fabulous people that are involved in our business school, like Dr. Jim Hatch, who's a finance prof, or on the medicine side, having events occur, whether it's to my family or friends that really influenced me to do certain things. You know, I was extremely fortunate. I trained here at the University of Toronto. Dr. John Wedge and Dr. Jim Wright are my mentors there, and they're both pediatric orthopedic surgeons like me. Both inspired me to take on this profession, and I think they noticed in me someone who would work hard and be dedicated to it. So part of it's about me understanding myself. Part of it, I think, is always about a mentor recognizing that you can focus somewhere and be successful.
When you think of an objective then that you would have had to state for yourself as you kind of got recognized and people showed you some of the strengths maybe you didn't really necessarily understand in their full kind of implication, when did you start to put some objectives for your own life?
I would say probably once I started into my orthopedics residency and was looking to what I would do when that was completed, where I wanted to end up, and two things were clear to me. I can articulate them better now than I probably could have then, but sure. I knew from the orthopedic side that I wanted to see children in clinic. You know, I pride myself on taking kids that can't play on the playground and letting them play again, and that's what pediatric orthopods do. Getting kids up and going. And on the business side of it, I had some very significant concerns about how the system was being managed and what things we weren't achieving when we really could. And that's really been the driving force behind myself doing an MBA when I did my residency, and then wanting to implement a similar program so other healthcare professionals could benefit from it in the future. And I've been fortunate enough, Dean Carol Stevenson's taken up that charge with me, and we're implementing a great program for the country now.
Well, congratulations for taking your conviction to action. Now, those are objectives kind of, I understand, within the systems that you existed. What about for yourself? Did you have any objectives for yourself kind of when you got started through all this? Even before the more focused side of things on the studies?
Do you mean from the standpoint of being successful personally?
Well, yeah, what were you kind of looking for Kellie? I mean, I understand the impact that you wanted to have, but what about for Kellie?
No, I don't know if it's necessarily for me, but I am driven to do public service. It's something I learned at the dinner table when I was a kid, that if you're given an opportunity to actually have an impact that can benefit more than you and your family, you should do it. And I view especially our health sector MBA program and the work that my colleagues and I do with the Children's Hospital is doing just that. We impact a lot of parents and families. The students from the Ivy School of Business will impact the healthcare system across the country, and those are all, those are the things that drive me to educate the students that I work with, and to provide the best quality care I can for the patients that come through our hospital. But from a personal perspective, I think it's about, having an objective of, always providing quality service, always making sure that I understand my patients well and take care of them, and being available. So I don't know if those are the objectives you're looking for from a personal perspective.
Well, you know what, it really depends on what they were for you, because nobody can dictate what one's objective should be. Yeah. And what often strikes me is how we are more hardwired or taught, I guess, not even hardwired, we're more taught to be more other focused, and sometimes that may or may not give us the opportunity to kind of ask ourselves our own personal objectives for our lives. Yeah. But right now, please stay with us. We're just going to take a quick break, and we're going to come back with Kellie and hear more what she has to say as a brilliant surgeon and businesswoman. So stay tuned. Thank you for joining us today and listening to Dr. Kellie's views on more and her ongoing journey towards it. Her name isn't actually Dr. Kellie, but for the purpose of the show, we're going to refer to her as Dr. Kellie, more real. So, Kellie, when we think of the different voices that any of us hear as we're seeking our own paths for awareness and objectives and, real tangibles, there's always kind of opposing voices, whether that's kind of on the inside or on the outside. And I'm curious, as you started to chart your own course, what were the opposing voices that you maybe heard along the way?
Well, I think for a lot of young professional women, the opposing voice that's always there is how much time do you want to dedicate to having a family versus your professional career. And I was, I grew up in a lovely family. My parents were at home and always available. I had opportunity to do great things.
That's great.
And my mother passed away at a very young age, and that has had a profound impact on what would drive me to do things. It's definitely had an impact on what balance I want to have if and when I have a family in the future. So I think that's probably one of the most substantive challenges for me, and I think for a lot of other young professional women. And that would probably be the most substantive. I can't really think of any other substantive challenges or barriers that would have been in my way.
So it was kind of a free, you were very much given the support and encouragement that you needed. It was kind of in line with what you were wanting. But this big question, I mean, that's a big one. That's not just a little one. So kind of how did you reconcile that? Like, how do you, even when you look at the huge impact you're having?
Well, as I say, I've been very fortunate. I grew up in a family household where my parents were available all the time and came to every band recital and every soccer practice. And I want to make sure that in the future I'm in a position where I can do that for my children as well. I right now have the privilege of taking care and seeing about 150 children in clinic every week and sending them home with other parents that I know they're well taken care of. And I hope in the future to embark on that type of experience for children of my own. But I want to make sure that the things that I do are in keeping with those values that my parents instilled in me, which are, making sure that you're always there, that you're responsible, that you're, you can provide your children choices in the future.
Now, those are all really excellent points. You really have gone down a road less traveled. And so what are some of the biggest realities that you became most aware of as you did that? I mean, one, we just heard you talk about the either or. What other realities did you kind of become more aware of as you started down this unventured path?
Well, I think that the mix of medicine and business is not absolutely unique to myself. There's, many physicians and also many business people that are now participating in that type of crossover. I've been fortunate that I've been ahead of the curve on that, and I can at least provide some wisdom to some of my colleagues about it, and my, I guess, more junior colleagues about it. I think the biggest objective that I guess the biggest hurdle I've noticed is that it's about managing your time so that you can be very effective in both fields. And I do struggle some weeks on which area to focus on the most, albeit that I've been very fortunate that the two do meld together, because what I do at the business school is really health industry related.
Sure. So that kind of addresses that issue, because you've got that healthcare component covered by focusing your MBA program in that area. How else do you kind of answer these questions for yourself? Like, how do you find your answers for more?
I'm not sure if I'm 100% sure
well,
what
some
you're
of these
looking
questions,
for.
you've raised a couple of the questions that are kind of on the radar for you.
Right.
And I hear you kind of, you acknowledge them as the questions, and I guess I'm curious how you plan on answering those questions, or how do you address your desires for more? Not the specifics of any one thing, but when you kind of come to that fork in the road, how is it you're kind of finding your more?
Well, I have a very conservative approach. I write down the fors and the againsts, and I have a handful of very close friends and a lovely supportive family that I ask for their advice. And I've been extremely fortunate that whether it's mentors, friends, or family, I've been given great advice on what direction to take. And each time I think one moves through their career, and I've been fortunate to do a lot of different things, but each time you move forward in your career, it's about making a decision of what things you won't do next. The responsibilities become more substantive, and you need to focus on them more. But it means some of those other things you may not be able, you need to either delegate off or move to other people. And those are challenging decisions.
Sure.
But if you have a good support base, individuals that really have your interests top of mind like I do, I think you can be successful and confident in the decisions that you make. And I've been successful so far in doing that. We'll see if that continues.
There's no one around us, but I'm sure that based on your skill set, Kellie, that won't be a problem. The problem that I do see associated with that is that there's never a shortage of people with opinions or input or voices that they wanted to tell us what they see as best for us.
Oh, for sure.
How do you kind of let the voices impact you? How do you decide which voice will impact you? Obviously, you've got this close network, but when the voices, how do they impact you?
Well, you know, from a very young age, I have a certain set of values to follow, and you know, those started when I was a child. So whether that's, you know,
are they fluid? Do you find, like, how much is kind of?
No, I don't think they're very fluid, and I think the closest friends that I have and the decisions that I have to make are based on those. So whether it's making sure that something's fair, something's equitable, that I know that I'm still going to have choices going forward, that if, you know, whoever I'm receiving the information from is steeped in integrity, those are the things that I look for. And you know, I'm not saying that I have, you know, 45 friends that are giving me advice, but I have a handful of people that I trust.
Of course.
And I hope that anyone else who is is a young professional moving forward, wanting to be successful, envelops themselves in that type of environment so that they can be successful too, and have those trustworthy, integrity-steeped advisors to direct them in the right direction.
Well, that's great, because you're right. I mean, without that, we're not meant to do it on our own. So it's important that to find those people that think like we think, who can appreciate the values and how they drive us.
Yeah, and I don't think it should be fluid. You know, I think I took some time earlier in my career, as I mentioned before, when I was a resident, and really thought about what are the things that are important to me from a value perspective.
But I think that there is a fluidity with the values, because Kellie, you kind of even talked about it yourself, how once upon a time at one juncture, certain desires or wants may not have been as prominent as they later show themselves to be. So is that a value shift? What is that really about?
I don't think it's a value shift. I think it's about making sure that you do have choices. You know, I will always value fairness. I will always value things being equitable, whether they're from me or someone else. But what choice I make may change.
Very
so I think there needs to be some, you know, stakes in the ground, some posts that you guide yourself by, and then you can make some very sound choices going forward.
That's fair. And you're right. I mean, there have to be some of those signposts along the way, or else we're never going to get anywhere. Let's pause for another short break and consider how Kellie's words parallel our own lives. Please stick around. We'll be back for more. Welcome back to more. Thanks for joining us. I'm Sheba Varghese, and with me today is Dr. Kellie Leitch. She's named as one of Canada's top 40 under 40, as well as one of Canada's 100 most powerful women, which is a national award to outstanding women leaders and professionals. Kellie, knowing that our vantage point really dictates our awareness at any given moment in time, what are you most aware of now?
Right now, I would think that the thing I'm the most aware of are the parents and the kids that come to my clinic and their viewpoints. You know, after I just had the great experience of doing a report for Health Canada and for the Minister of Health, it was a privilege. And it enlightened me to the challenges that Canadian parents and children face. You know, I'm a pediatric orthopedic surgeon. I see kids that fall off swing sets. I get to put casts on them, get them back on the playground. But I had this enriching experience of learning about, you know, the challenges of mental health issues that children face in the country, and the challenges of obesity that many children face. These are things I don't see in my clinic. And I'm much more acutely aware of what those parents and those children need, and I think that makes me a better physician because of it. And I'm hopeful that moving forward I can impact some change in those areas that I've heard about, at least. I know they're not all encompassing, but at least impact some change in those areas so that Canadian kids can be fitter, healthier, happier kids.
That sounds like it would be right up your alley. Obviously, it's what you do. How do you fulfill your need for more with this new awareness or this new vantage point based on the report that you've done?
Well, it's provided myself an opportunity, and I think many other individuals a voice to become true public advocates for Canadian parents and kids. You know, when you stand in an operating room or you work in a clinic as a physician or another healthcare professional, you see kids for a very short period of time. And yes, we have an impact on them, but it's just a finite one. Some of the things that I've learned and some of the organizations that I've become in contact with, I think that there's opportunity for professionals and those organizations to have a much more profound impact on children's lives. And that's really meaningful to me, and I hope that moving forward I can have a more meaningful impact on not only a certain number of kids, but a greater number of children, but maybe even more of an impact on a single child.
Well, you know what, that sounds like it'll make you really add to making you a great parent. Should that
Well,
happen?
we'll see.
Yeah, it's great to have this kind of awareness and being able to ask yourself, what do I want to see, and what are the changes I want to make in my own children's lives,
Absolutely.
or in the lives of those that come into contact. So it's a privilege to
Well, you're a
know
parent
that
yourself. You know what this is all about.
I am, but it's a privilege to know there's people like you that are touching the lives of our kids, right? And so that's great.
I appreciate that.
That's great. What do you find is the biggest challenge to being true to yourself now?
The biggest challenge for myself?
Because you're very much about the job, and that's great. You've accomplished a lot of great things, and you've done well. But I'm really curious about this woman in front of me, this incredibly intelligent, strong, ambitious, change-oriented person. How do you be true to who all that is?
I think that right now I am being true to it. And I'm being true to it because I've been given great opportunities. And I think the next step for myself is making sure that the things that I've started, we complete and they're done well, and that I look for what the next opportunity to impact and have some change is. I don't know what that is yet, but I'm sure, given the opportunities I've been given in the past, there'll be something new, and I can, take on another challenge that, and hopefully contribute to developing and strengthening the country by taking on that challenge.
That's great. So if I hear what you're saying, really in terms of the biggest way to be true to yourself is to kind of continue looking at the good that you're able to provide to your patients, to the medical profession as a whole, and as well for the others in the MBA program or whatnot that are in the healthcare sector, and then bringing the business acumen to kind of help them be more strategic in how they're...
Yeah, I think they all build upon each other. But, I'm sure you've witnessed this in your own life, is that at a certain time you decide that there's yet another challenge to take on. And that hasn't presented itself to me yet, but hopefully in the future there will be, so that I can make sure that the things that I've started and accomplished already are strong and steady and true. And then move on to the next challenge that can have a meaningful impact on whether it's Canadian kids and youth or the Canadian public.
Sounds like faith is a real part of kind of that philosophy, that approach to kind of what may come.
Possibly. As I said before, I sort of grew up in a family where there were certain values that were espoused at the dinner table.
So you have faith in those values, and that's great. And that's just great. So you're a young woman, you have a big appetite for more. What role will or does awareness play for you as you plan on going forward, as you wait and see kind of what the opportunity that's going to bring itself is? How do you plan to use your awareness of where you're at to go forward?
I think you just need to be open-minded. You need to, there's a strong tendency, I think, for many people to, and I've witnessed this myself, is you become quite siloed in your job, and it's important so that you're focused and you do an excellent job at what you're doing. But you also have to be open-minded and look for those other opportunities where you can have a more substantive impact. Particularly, I know that your focus is on, giving some direction for new young professionals and what they should be doing. I would strongly encourage them to become excellent at what they do themselves.
But
at the same time is still be open-minded and make sure that if there is a new opportunity that where they can either provide public service or be a volunteer or professionally, that they take advantage of that and they captivate it.
Sure, no, that's all great. And the irony of it is, I don't do any work with any young people. All my work is with senior executives. And what strikes me most about that is they're at a point in their lives, in their careers, everything is going well and great, but they're looking for truth. They're looking at, what really matters, and how do I be on top of my game in a different way than maybe I've traditionally been looking. And that's really what it's about. It's about that awareness piece. So I really thank you, Kellie, for coming in and taking the time to share with us, the realities that you have been most touched by or impacted by, and kind of what that means for you going forward. And really do appreciate you coming in to speak with us today.
Thanks for having me, Sheila.
Thanks a lot, Kelly. Awareness may not always be pretty, but it is real. And it's only when we have increased awareness that we can begin to make the right choices for our lives. So stop censoring yourself, and definitely stop letting others censor you. Notice when you feel most alive, and trust that the universe will respond to your joy in a very cause and effect kind of way. To be forewarned is to be forearmed. So go, knowing that the world we live in does not invite awareness or truth. It only offers an artificial system that we have to exist in, made up to keep us focused on the wrong end of the problem. Delight in knowing that only you know the questions that most need answering. And be prepared to set some standards for yourself, because without them, you're at the mercy of everything and everyone around you. Invite you to contact us via our blog, and as some of you already know, we do answer those emails and are always recruiting people whose actions show conviction. Thank you for watching the show, and please know that next week you're invited back to join us for an interview with Louis Mel, former president of McDonald's Canada. And until then, remember, in all that you do, do it for truth.